Mesothelioma survival rates. About 40% of patients with mesothelioma survive the first year after diagnosis. That survival rate depends on many factors, including age, cancer stage, cancer type, race, and gender. Long-term survivors attribute their success to treatment from a mesothelioma specialist, alternative medicine, and nutritional changes. Age. Overall, older mesothelioma patients have a much lower survival rate than younger ones. More than 50% of patients diagnosed before the age of 50 live 1 year, but less than 33% of patients 75 or older live the same amount of time. Rates are similar for long-term survival. Younger patients have a 20% chance of surviving a decade, older individuals have a 1% chance. This difference is largely because younger patients are eligible for more intensive treatments like surgery. Older individuals may not be candidates for these procedures because of poor overall health or a high risk of complications. Elderly people often manage one or more chronic medical conditions in addition to mesothelioma, such as diabetes, heart disease, and COPD. Survival is generally better for younger people because they are less likely to have serious conditions that may make them ineligible for effective treatment options. It's rare when someone younger than 50 receives a diagnosis of asbestos-related cancer. The average age at diagnosis is 60, and from 1999 to 2010, nearly 80% of Americans who died from mesothelioma were older than 65. Gender. Research shows that women with pleural mesothelioma experience nearly threefold better survival rate compared to men. After analyzing more than 14,000 pleural mesothelioma cases reported in the National Cancer Institute's SEER database from 1973 to 2009, researchers found that the overall 5-year survival rate for men was 4.5%, compared with 13.4% for women. Most asbestos exposure occurs in the workplace, particularly in industrial jobs traditionally held by men. That helps explain why men account for around 80% of all mesothelioma cases. When asbestos use was far more pervasive decades ago, the few women who did develop a related illness were usually exposed because they lived near mines or factories, especially those that processed the mineral. Women also found themselves exposed by spouses, family members, or friends who worked around asbestos brought home the tiny fibers on their clothes. Race. Mesothelioma is almost exclusive to white individuals, who make up 95% of patients. This vast difference may be in large part because Black and Hispanic individuals are less likely to be diagnosed with any type of cancer, mesothelioma included. Data from SEER state that African Americans and Hispanics account for only 8% of all cancer diagnoses. Regardless of race, about 40% of mesothelioma patients survive 1 year. 2 years from diagnosis, approximately 20% of patients survive. Although race does not appear to impact mesothelioma survival rate initially, as time goes on race becomes a more telling factor. From 3 years on, the survival rate of white patients is slightly worse than other ethnicities. 5-year survival among whites is 7.6%, compared with 12.3% for blacks. After 10 years, only 4.2% of white patients survive, while 9.5% of blacks are alive after the same amount of time. SEER data used to calculate these survival rates includes Hispanics among patients who identify as both black and white. Because mesothelioma is so rare among other races, reliable survival statistics are not available. Survival rates by ethnicity may be influenced by treatment decisions. One 2010 report that studied mesothelioma rates from 1990 to 2004 concluded that although Black and Hispanic patients have better long-term survival, they are less likely to undergo surgery. While 25% of white patients received surgery during this time, among Black patients the rate was 14%.